Coronavirus, The Rundown. I'm Chris Stewart. Each day on this show, we show you how American communities are taking on coronavirus. We're also breaking down the rush of headlines, and today, new cases seem to be leveling out. The curve is flattening in the United States. Dr. Anthony Fauci says new case levels are dropping, except for in a couple of cities that haven't peaked yet. Global cases passed 2 million on Wednesday, according to Johns Hopkins University. Social distancing could be common for the next couple of years. A new Harvard study found stay-at-home orders and school closures may be necessary, at least intermittently, until at least 2022.
The virus is around in a few people, and we aren't imposing control measures. It will resurge.
The researchers call social distancing one of the most powerful weapons against coronavirus. A new round of March numbers show just how hard coronavirus is hitting the economy. Retail sank 8.7%, setting a new record, more than doubling the last one. Sales were down across the board. 51% at clothing stores, 27% at restaurants and bars, and car sales were down 26%. Industrial sectors also saw record losses in March, the biggest decline since 1946. JP Morgan Chase predicts the economy will shrink 40% between now and June. And a growing number of Americans can't afford their rent or mortgage payment right now. Alicia Nieves is taking a look at the impact.
These are challenging times, reflected in alarming numbers. More than 26,000 people have died from COVID-19 in the U.S. At least 600,000 people have been diagnosed with the virus, and an estimated 16 million Americans have had to file for unemployment.
Everyone is having a hard time.
Igor Popov is with Apartment List, which conducted a nationwide survey amongst renters and homeowners that's revealed the latest concerning numbers.
1 in 4 renters couldn't make their full rent for April, and 1 in 4 homeowners also couldn't make their April mortgage payment in full. Half of the people that couldn't make it in full didn't make a payment at all.
That's an estimated 80 million Americans who struggle to pay one of their most essential bills. And the survey is actually more optimistic than one done by the National Multifamily Housing Council. NMHC's showed as many as 1 in 3 Americans were unable to pay their rent in April.
One of the things we found was that among those that weren't able to pay their April rent in full, almost half of those had reached some sort of agreement with their landlord or their property manager to either defer payments, to have reduced payments. And also 1 in 9 renters actually said that their landlord proactively lowered their rent for April.
With stimulus checks getting out to millions of Americans this week, Apartment List found many people plan to use those checks to pay their backed up or next month's mortgage or rent. But should shelter-in-place mandates continue into May and June, Apartment List says we could see 27% of renters and 13% of homeowners unable to pay their rent or mortgage.
I think what's becoming apparent is that the sooner that the conversation can begin, the better. I think that we're finding that a lot of landlord-renter pairs are able to work out arrangements.
The same applies for homeowners and their lenders. Federally backed mortgages are allowing people to defer or reduce their mortgage now for up to a year, while private lenders are offering flexibility too. The key here is also contacting your lender as early as possible. I'm Alicia Nieves reporting.
Alicia, thank you. Now, if you are waiting on your stimulus payment, the IRS has a new tool to track the money. The first payments went out this week, starting with the lowest income Americans and those on Social Security who have direct deposit set up with the IRS. Now, to track your payment, go to the IRS website. You can find the tool on the Get Coronavirus Tax Relief tab. You might need information from your last tax return. Car loans are not part of economic relief packages. Banks and dealerships can still repossess cars for people who default on their loans.
Nobody wants to foreclose on your car, so it's about ringing up, having a sensible conversation, explaining the position you find yourself in, and then looking at the options available.
Auto website Edmunds says car makers are creating their own programs to defer loan payments that range from 2 to 6 months. Edmunds says banks should be willing to work with you. Now, these programs vary on how and when you pay those deferred payments. Now, in many mortgage programs, they just tack the payments onto the end of the loan. In any case, deferring payments should not impact credit. If you are leasing, contract extension options are in the works. Now, coronavirus is affecting Americans in unique ways. Our partners at Newsy caught up with a farmer to see how life has changed.
My name is Clara Cadwell. My family has been farming here in Santa Barbara County for 7 generations. We are certified organic and specialize in heirloom vegetables, primarily heirloom tomatoes, winter squash, and chilies. Life has changed for me, just like it has for everybody. I have been working the last 4 years doing deliveries to local restaurants 2 times a week. And last week, I managed to sell 1 box of peas.
Thank you. Have a good weekend.
So we went from delivering wholesale produce to restaurants and to grocery stores to delivering door-to-door produce. So we have the Farm Box Collective, which delivers vegetables to your doorstep. People are still getting access to healthy food, which is very important in a time like this when people are getting sick. And it's not just from my family's farm. So the collective is representing all of our local farms. Those local farms don't have other access of sales, and we're hoping to create, through this community-supported agriculture, CSA, an outlet that they can rely on for their products. Vegetables and fruits don't stop for a virus. They're already planted, and all of our funding is in that planting. Agriculture is an essential business. Without farming, there is no food. California in particular, California produces almost all of the food of our nation. No offense to anyone else, but it's true. And if we close down our farms, or if we're not moving that food, that will shut down our national food system. We are as safe as we can possibly be, take all the measures to be safe, but I'm very fearful for my grandma catching anything, and I'm very fearful for those families that don't have access to food and space and fresh air, and can have 4 months off and still make it and still be part of our community. And that's a large group of our community, and we don't want to lose them. Where would they go? I don't understand what the solution is to that, but it's frightening.
And a new report says China took almost a week to warn the new coronavirus was on track to becoming a pandemic. According to the Associated Press, Chinese President Xi Jinping knew of the threat before the Lunar New Year, but didn't warn the public until after celebrations were over. The AP reports it obtained documents showing thousands of people became infected that week. The report suggests an earlier warning could have helped curb case levels and ease the burden on hospitals. Scientists are working on several treatments for coronavirus, and that includes using a recovered patient's plasma to treat current patients. We talked to one man about his donation. And will working from home be the new normal? A look at how coronavirus is changing the typical workday. Next.
Together.
As states and cities work to figure out when they can return to normal, researchers are working on finding a treatment. Pharmaceutical companies are looking at existing drugs to treat COVID-19. Experts believe repurposing drugs may be the quickest path to treatment. Drugs that treat malaria and Ebola are being tested in small batches right now. And there have been some promising results in the small group of test patients, but it's still unclear if these drugs will be successful for the general population. Dr. Anthony Fauci says a vaccine designed specifically for coronavirus is the long-term solution, and other doctors agree.
If we could get a vaccine, that would be a total game changer. That's a long way off. That's probably almost certainly a year off.
Any vaccine would need to go through 3 phases of clinical trials before the FDA approves it. That could take anywhere between a year to 18 months. Johnson & Johnson is developing a preventative vaccine. It expects the vaccine to be available by 2021 for emergency use. The National Institute of Health is developing a vaccine that is specifically for healthcare workers. It could be ready as soon as this fall or possibly next spring. Now, doctors at Ohio State are testing plasma on COVID-19 patients. Doctors say that plasma from patients who have recovered contains useful antibodies.
When a person is confronted by a virus, they will make antibodies to that virus that eventually will coat the virus and help the body to eliminate the virus. And those antibodies are what's vital.
The antibodies essentially give the patient a boost to their immune system. OSU doctors have tested this on one patient, but say it is just too early to tell if it works. Now, a Florida man who survived coronavirus just gave his plasma to help others in the battle. John Shaman talked to that man about his potentially life-saving donation.
We love you, Dad.
You gotta come on home, baby.
Stacey Rathel of Orlando shares what she calls God's Easter miracle.
Daddy!
She and her family connecting with husband Kevin, who was in a medically induced coma for a week.
And he had tears that ran down his cheeks. And even the doctor said, "Did you see that? Those were tears."
Rathel had recently received a plasma donation from James Crocker of Stewart. Crocker tested positive for the coronavirus after a family funeral in Palm City.
Couldn't work, couldn't sleep for the cough. I had a really bad dry cough.
Crocker, who's since recovered, learned of Rathel's plight through a mutual friend.
I don't have a medical degree. I don't have any medical training. I have really nothing to offer the medical community until now.
Convalescent plasma uses blood from coronavirus survivors to help patients with COVID-19. The FDA recently approved it for emergency use on a case-by-case basis.
It says there's hope. It says there's hope.
But I think the vast majority of human beings, if they realize that they have the power to save a life, who wouldn't do that?
While it's too soon to see how Kevin will ultimately respond, the Rathels say other relatives who've survived coronavirus are already making plasma donations, trying to help and add hope.
All right, John, thank you. And as many as a fifth of cases in the U.S. are in healthcare workers. The CDC just put out a new report that says the number is probably higher than that. Now, not all states have complete reporting. It found so far healthcare workers have been hospitalized less often than others. Healthcare workers reportedly make up about 10% of cases in countries like Italy and Spain. Now, coronavirus has changed what a typical day at work looks like for so many Americans. And Chris Conti asked experts if these changes are here to stay.
She was feeling really sad, and I had the same kind of conversations with her.
As a high school biology teacher, this is the one place Mariah Toomey never imagined would become her classroom.
But if you could be flexible with her in terms of like due dates, that would be really helpful.
Crammed inside a one-bedroom apartment in the middle of downtown Boston.
I'm used to like being up and moving and interacting with them and not being like behind a computer seated all day, and that's like been my reality since we closed.
Like millions of other Americans, working from home was never a possibility for Mariah until now. And while it's no substitute for the classroom, she's still able to teach.
I've actually been in contact with some kids like a lot more than I was kind of in school.
You also lose the kind of the human interaction that just comes with a smiling face, a warm greeting, a hearty hello.
That is Steve Pemberton. He's the Chief Human Resources Officer for WorkHuman. They have spent years studying how this nation works.
This is not going to be a matter, Chris, of somehow we ring the bell and then, it's kind of like we get the all clear and then, humanity goes back to doing things the way that we did them.
On the other side of the epidemic, Steve believes many companies will find themselves re-examining work-from-home policies.
You begin to realize, no, you didn't lose anything in the way of productivity because you didn't have a choice.
It's not just productivity. With coronavirus keeping countless people home, it's also kept them out of their cars. Steve thinks many companies will see the positive impact the epidemic is having on congestion in major metropolitan areas, pushing some businesses to say, maybe we don't need people commuting as much.
It's going to change things profoundly because part of this realization is going to be that the way we were is what got us to where we are.
And many companies spend tens, even hundreds of thousands of dollars a year on office space. Once the epidemic is over, they may decide they no longer need that physical space.
There's no facet of work that this has not touched and won't touch for the foreseeable future.
I'm not feeling like I'm providing like the same level of education online.
For teachers like Mariah Toomey, who never thought they'd be working from home, this epidemic has provided a lesson in resiliency.
And just like missing seeing kids every day, missing like colleague interaction. So that's like been hard too.
In Boston, I'm Chris Conti reporting.
Chris, thank you. Now, it is spring, and so many farmers are planting their crops. Well, they're facing shortages of workers needed to help. The impact that could have. Next. Welcome back. For some farmers, spring means some of their crops are getting ready to be harvested. But coronavirus is creating a challenge for farmers who, as Maya Rodriguez shows us, can't find enough workers to help with their crops.
Across more than 2,000 acres in Southern Virginia, Robert Mills lives his life's work at Briarview Farms.
We're a pretty diverse operation.
It's a nimble operation he runs with his family and about 10 workers.
Most of the workers that do come here are through the H-2A program, which is a guest visa program that's administered through the federal government.
But he's having trouble getting those workers. Because of the coronavirus, the U.S. is not processing any new guest worker visa applications. But Mills's workers are not new. They've worked on his farm before, but still haven't been allowed to enter the country this year.
We don't know what the holdup is right now. There's no red flags flying showing that why our workers are being delayed some.
While Mills uses fewer than 10 guest workers, other farms in the U.S. use many more to harvest their crops. The Department of Labor says in March and April of last year, there were more than 77,000 H-2A visas issued.
When you start talking about perishable items, it's very critical that we get that workforce here.
Mills hoped to find some help in the new $2 trillion federal stimulus package, which is also supposed to help farmers. But it turns out, not his farm.
Because I work H-2A workers, I didn't qualify. And so that was very disappointing to me.
But on the farm, there are other issues beyond just getting workers. Prices on a number of agriculture products remain low.
So we were already in a depressed market because of the tariff.
The tariff refers to what many farmers are still reeling from, the recent U.S. trade war with China. The president addressed it during a coronavirus briefing.
As of April 1st, the China trade deal, $250 billion. They purchased $250 billion from us, if not more. And of that, approximately $50 billion is expected to be with our farmers.
Back at Briarview Farms,
we're talking about food safety and food security.
Robert Mills says he hopes farms like his can weather this latest storm.
We're a resilient group of people, and this too shall pass. But right now, we got to make sure that our agricultural community is looked after.
An ag community we all depend on. In Callens, Virginia, I'm Maya Rodriguez reporting.
Maya, thank you. Now, a business owner is helping supply face shields to people in need. How he ended up developing prototypes of shields for babies.
Fuel are proud supporters of local literacy.
Welcome back. We end the rundown each day with stories that remind us of the good that is going on right now all around us. And today, it's the group from Virginia that is making face shields for babies. Take a look at that picture on your screen. Bert Green turning his manufacturing business into a workshop, making face shields for first responders. But then he heard from children's hospitals about a specific need, one for shields for infants. So he ended up scaling down an adult-sized mask and had a prototype within hours.
It's everyone coming together to try to figure out how we can help those that are in greatest need right now. As long as there's a need out there, we're going to continue to fill that need.
Now, these are just prototypes for the moment. Green's team has shipped hundreds of shields to first responders. And that's all the time we have today for Coronavirus The Rundown. We'll see you next time. I'm Chris Stewart. Thanks for joining us.